The first bill on the agenda today is House File 4438 from Chair Bierman. Chair Bierman, would you like to move your bill?
Yes, Madam Chair, I'd like to move House File 4438.
Chair Bierman moves that House File 4438 be recommended to be placed on the General Register. Chair Bierman, I understand that you have a DE1 Authors Amendment. Would you explain and move your amendment?
Thank you, Madam Chair. I'd like to move the DE1. The DE1 has a number of technical updates from MDH to ensure critical public health programs are run efficiently and without disruption, supporting stronger collaboration across public health partners, and streamlining outdated reporting requirements to provide clarity in public health information. So that would be the DE1. There are some specifics I can speak to as well. For instance, Section 1 permits Palliative Care Advisory Council to provide reports to the legislature every other year. Section 2 and 3 combines two separate suicide prevention reports into a single biennial report. Section 4 and 5 is a federal conformity issue, aligning Minnesota statutes with federal guidance. This is for WIC, and this will improve service continuity for families relying on nutrition benefits. Section 6 addresses the State Community Health Services Advisory Committee by allowing tribal governments to participate in state public health advisory committees. This will strengthen our partnership across the state and improve statewide public health. Section 7 and to 9 are cleanup of statutory language for audiology and speech-language pathology updates, and that is the exciting high points of this bill.
Thank you, Chair Bierman. Chair Bierman moves adoption of the DE1 amendment. Any discussion? Representative Nadeau.
Thank you, Madam Chair. And just one question, Representative Bierman, is are we changing, so like I'll just use SNAP and WIC, we're moving to being exempt from, speedy contracting, 16C. Is this typical for SNAP and WIC, or is this something new?
I have
Chair
Ms.
Bierman.
Timian here, Madam Chair. I have Ms. Timian here. I'll have her do a deeper dive on that for you. All right?
Ms. Timian.
Thank you.
Yep. Madam Chair, members of the committee, for the record, my name is Lisa Timian. I'm the Director of Government Relations for the Minnesota Department of Health. So yes, to your question, Representative Nadeau, this is really just, it's essentially still a 5-year contract, but then can be extended up to 10 years. So there's still the same amount of program integrity and our ability to make changes if needed or if we see an issue. We haven't seen issues in this problem with the WIC program and how it's administered, but this should just make it easier for the counties and community health boards who administer this program at the local level to have the steady technology that is needed.
Thank
Vice Chair Nadeau.
Thank you.
Chair Backer.
Thank you, Chair, Madam Chair. So with the WIC program and stuff, what does that mean to the end user and to the businesses that provide that? What will that mean if we make this change?
Ms. Timian. Oh, or
Chair-
Chair Bierman.
Madam Chair, members of the committee, Chair Backer, so this is really, it should make everything more technologically efficient for everyone involved, just because they have this continuity of a technology contract that all their systems can meet, speak with, and all that. So it should be an easier system for everyone to use.
Chair Backer.
So right now, if the counties cannot communicate right now? Go ahead.
Ms. Timian.
Madam Chair, members of the committee, Chair Backer, no, this is really just, this is an update to the current practice that instead of it's a 5-year contract cycle, now it would be a 5-year contract cycle with the ability to renew for up to 10 years on this, just so that allows a little bit more time with the program itself without needing to update.
Okay, thank you.
Seeing no further discussion, all those in favor of adopting the DE1 amendment, say aye. Aye. Those opposed? The motion prevails and the amendment is adopted. We'll now move to testifiers. No testifiers. We have done what needs to be done. Closing comments.
Good bill. Hope you will vote for the, or it's going to
I'm
be
sorry.
laid over, yeah?
I'm sorry. Discussion to the bill.
Yes.
Silly me. Vice Chair Nadeau.
Thank you, Madam Chair. And thank you, Representative Bierman. A couple of weeks ago, and this has to do with the reports that we require our agencies to submit to us, and because this bill is a lot about reports, there was a bill a few weeks ago, and it had to do with the Community Clinic Health Grant Report. And I was looking for those reports for the bill, and I was informed by the Legislative Reference Library that in 2023, that was listed under a report that the department no longer wanted to provide. And it's the Health Legislative Report Sunsets bill that the committee never voted on, but the agencies have decided to enact those and decide when and where they want to kind of submit those reports. So I would love to have Lisa talk about the reports and if these will be sunsetted without the legislature making that decision, and if that will be included in some other bill at some point in time.
Chair Bierman or Ms. Timian?
Madam Chair, Representative Nadeau, so your question was to the Legislative Sunsets Report. So that was this was, I think, from 2021. There was new ability for agencies to identify reports that didn't meet certain conditions so they could be sunset. MDH has not identified reports to be sunset in the last 2 or 3 years at this point, so we have not submitted any reports for sunset. So at this point, we're still producing all of the reports, to my understanding, that we're required to be producing. If you're finding that that's not the case, though, I'd be happy to talk to you about that.
Vice Chair Nadeau.
And thank you. And I'm looking at the Sunset Report document right now. Suicide Prevention Plan Progress Report, Statewide Health Improvement Program, Tobacco Use Prevention, Vulnerable Adult Maltreatment. And so, like I say, the bill that was in 23 was never acted on by the committee, but the agencies have apparently decided that they're going to sunset these. And I just want to make sure that these reports in Representative Bierman's bill are not going to be sunset by the agency without coming back to the legislature. That's my question.
Chair Bierman, Ms. Timian?
Madam Chair, Representative Nadeau, yeah, so our intention with this is just to make sure that we have a little bit more clarity with some of the reports that we do provide for you all. To the question of the 2023, I would have to go back to look at that as well to see if we missed something or if we're not implementing something correctly. But I will look at the language from the 2023 session and get back to you on that question for reports.
Thank you, Ms. Timian. You can get that back to committee administrator, please. Vice Chair Nadeau?
I'm done, thank you.
Okay. And Representative, just Keeler. Representative Liebling.
Yeah, thank you. And I can maybe shed a little bit more light or maybe more confusion on the issue. I'm not sure which.
No more confusion.
But there was,
can't handle it.
there was legislation passed some years ago. I don't know if it was 21, but actually there's sort of an automatic sunsetting of reports if they're not continued. So in other words, there was an effort to, we pass reports into law and then they just continue forever, or this is how it used to be, even if no one ever used them, looked at them, cared about them. And so I think in an effort to make reports be more meaningful, if we're spending money on them as a state, they should be useful for somebody. There's sort of a piece of statute somewhere that sunsets them automatically, but I think there's a report that comes out first to tell us what will be sunset so that we can object to that. And I guess I would just ask House Research, maybe not this second, but maybe in the future, to make us all aware of that, because I have frankly lost track of that a little bit. And I do occasionally wonder whether a report that I'm interested in is still going to be produced. So I think it is a useful point that you're bringing up, a helpful one, Representative Nadeau, and I think we should be aware of these. But I don't think it's, in my memory, it's not the agency deciding that a report should, it happens by operation of law unless we object to it. So I just would ask House Research maybe to make note of that and kind of advise us at some point so that we can all kind of have it top of mind. Thank you.
Vice Chair Nadeau.
And thank you, Representative Liebling. And it's section 144.05 subdivision 7 is the statute that requires the sunsetted reports report. And the reason I know this is because, like I say, I tried to look at the community clinic health grants, and and again, the last few years, there was COVID. There was a lot of reports that weren't generated during COVID, and I think we all understand and accept that. But, you know, when they're not sunset, and community health grant reports, for example, the library sent a number of notifications to the agency, but they never did receive those reports. And so that's where I was trying to have this conversation. There are some of us that actually, you know, really do read these reports and try to be informed as we make these decisions. And I just don't, and maybe I need to work on 144, you know, .05 and make sure that that's where it is. But I just want to make sure that, you know, the work that we're doing here today and we're asking the agencies to perform is actually coming back and informing us in our legislative process. So thank you for indulging me.
Thank you. Seeing no further discussion, Chair Bierman, closing comments.
Thank you, members, for the discussion, and thank you, Representative Nadeau, specifically for that comment on the prevention reports as far as suicide goes. That's something I want to make sure we're getting the reports. And with violence prevention, specifically gun violence prevention, that's an incredibly important report that we need to expand and develop, not restrict or stop. So we'll need to make sure that one's coming through. That's it. Thank you very much. Hope to continue your support on this bill as we move forward, and more feedback is always welcome. Thank you.
Thank you, Chair Bierman. Chair Bierman renews the motion that House File 4438, as amended, be recommended to be placed on the general register. All those in favor say aye. Aye. Opposed?
Nay.
The motion prevails, and House File 4438, as amended, is recommended to be placed on the general register.